Hey there, welcome everyone. I'm Melody Mendez, an anchor and reporter here at NBC 10 Boston. And like many people who are probably watching right now, I'm a parent who knows how rewarding and how demanding raising children can be. There was a recent advisory by the US Surgeon General basically calling mental health and the well being of parents and caregivers an urgent public health priority. Think about that, an urgent public health priority. Parents describe financial strain, they describe time pressure, isolation, worries about their kids, not to mention a constant stream of advice going into their brains about how to get parenting right, supposedly. So today we're going to look at why so many parents are really struggling, the impact it's having on our kids and on our family relationships, and what we can do, what our families can do, our communities, what they can do, and what health systems and employers and policymakers can all do to help us parents navigate this. So to do that, I'm joined by our esteemed panelists, and I want to introduce each one. So Archana Basu is a clinical psychologist at Mass General Hospital and a research scientist at the Harvard Chan School of Public Health. Karistan Kunin is professor of psychiatric epidemiology at Harvard Chan School of Public Health. Jane Singer is a clinical psychologist and leader in developmental and relational health at Boston Children's Hospital, and as well as the Brazelton Touchpoints Center. And lastly, Richard Weisbord, senior lecturer at Harvard Graduate School of Education and director of Making Caring Common. So thank you all so much for being here. Karistan, let's start with you and the big picture here. What are parents facing today? What are they facing, and why should parental mental health be understood as an urgent public health issue?
Well, I don't think it'll be any surprise to anyone listening that parents are stressed. And in the Surgeon General's report, it said about 50% of parents are reporting such a high level of stress that it's interfering with their lives. It's really interfering with their functioning. And I think there are so many reasons why, but I think the first thing I want to say that there isn't anything wrong with the parents themselves. I think when we're stressed as parents, we often blame ourselves, like we should be handling things, we could do something better. But parents are facing so many systemic challenges that didn't exist. Like, for example, when I was a child. So challenges coming out of the COVID-19 pandemic, challenges with lower incomes, higher childcare costs, fewer community supports being eroded, family. I grew up in my grandmother's house, fewer extended family supports. And so all these community and contextual factors and this increased uncertainty, like you said, the barrage of information from social media and global events coming in. So it's less support, more uncertainty, more kind of threatening information come in. It's natural to feel stressed. And I think the things we need to think about, I know some things we're going to talk about are things parents can do, but also policies and things communities need to do to better support parents.
Karistan, what is the greatest barriers to support that families are facing? Because all of those things that you said are true. All of those things that you said parents are feeling, I could have raised my hand for each one.
Yeah, me too. I'm a parent too.
Why can't we all get help?
So I'm a parent too, although my son's now 19, so different age than your kids. And, I think one of the biggest challenges is that telling parents to do another thing. They need to do another thing. So now you need to do X, Y, and Z to get support. And I'd like us to think about changing our thinking and what are the structural things we can do, what we can put into place so that parents get more support in the environments they're already in, rather than having to do another thing. Because we could name, income, there's many things that get in the way of getting help, but I think time and logistics around time is one of the biggest challenges.
Archana, I want to bring you into the conversation here. because we talk about time being such a barrier. And I think everyone across every parent, across all socioeconomic classes, across nationalities, across any demographic, time is limited, right? It's this precious resource. Uh, how is there any way to prevent, when we talk about prevention or early support, can anything happen before a diagnosable condition or crisis when time is such a barrier?
Absolutely. And I think you are right to raise this issue of need in terms of starting early rather than waiting for more emergent issues or crises. And I think the key here is recognizing early on when there's distress, difficulty, coping day to day, when it's starting to, show up in how we're engaging with our family, with children, maybe how we are showing up at work. The things that Dr. Conan mentioned start to impact daily functioning. So recognizing initial signs of distress and seeking help early is really the key here. And what this speaks to is how do we make these early resources available early on to the vast majority of people. So the Surgeon General's report, as Dr. Conan highlighted some statistics, nearly 50% of parents are saying that the stress is completely overwhelming. How do we get early care to a big group of the population, to so many of the parents? The one thing this does do is make the struggle normative, make it clear that it's not exceptional or deviant. Mm-hmm. So it's in a way destigmatizing, it's validating, but the key here is scalable population level access to health services.
And I guess just to start and jump in there, one of the things we do know, there's really good evidence, for example, that paid parental leave reduces parental stress. There's been really good causal evidence, policy studies. So there's things like that too. There's things that can be put into place that we already know reduce parental stress. And it just takes the policy will to do that.
Okay. Richard, I want to bring you into the conversation because as a parent, there is this constant feeling, and I know I'm not alone here, of falling short. I'm constantly talking to my other mom friends and my husband and other parents. There is this feeling that we're still not good enough, still not doing enough, even when we're working extraordinarily hard. What's driving this sense of failure, and what is it doing to our families to just feel this constant burden of it's not enough?
Well, it's a wonderful question. I would first say I think there are big race, class, and culture differences in this, and that for a lot of low-income families, not doing enough means a mom who's working two or three jobs just to make ends meet and has very little time for her kids. And that's very different than a middle or upper class parent who's hyper focused on their kids' achievement, which is something that's going on, and hyper focused on their kids' happiness, which is going on. So I think these are different phenomena in a lot of ways. I guess I would say a couple things. There's a lot of concern about helicopter parenting and snowplow parenting, and I think that's real. And I worry particularly about parents swooping in to resolve minor peer conflicts or kind of trying to curate their kids' lives so they don't have any adversity. Because I think, again, middle and upper class communities, adversity is how we develop coping strategies. Adversity is really so important for our long-term well-being. And we don't all need to be monitoring our kids' moods every second either. I mean, I don't think that's good for kids either. But I also think, and I'm gonna quit yakking in a minute, but I think we're focusing on the wrong things often, and that this hyper focus on achievement and on well-being moment to moment often overwhelms our focus on our kids really tuning into other people, empathizing with other people, caring for other people. And when they're able to do those things, they're going to have better relationships their whole lives. They're going to be better parents. They're going to be better romantic partners, better friends. And that's the most robust and durable source of happiness that we have. So I think that parents can step back. And I also think if they're going to hyper focus, better to hyper focus on caring than on achievement.
I love that message. And I think that's one
Beautiful.
every parent we could all do well to remember more of. Jane Singer, I'd like to bring you into the conversation now. Um, how does social media and all of this advice that's being thrown our way, how does this undermine parental confidence? Because I often find that when there are, I mean, I had to get off of social media because it was just too much comparing myself to these perfect parents and feeling like I'm not good enough. And I know I'm not alone here. Um, I can't imagine that's helpful to anyone.
Yeah, that's also a great question. Thank you for that question. I really feel for parents when they are literally flooded, right, with advice and guidance that is largely organized, especially on social media, around preventing challenges with their children.
Mm.
And Richard started to address this with his comments about adversity. Challenges are healthy and necessary, right? We all need to experience some level of challenge in our upbringing in order to develop coping and resilience. I think that what I would most, if there's like one thing that I would love for parents to take from my comments today, is to understand and truly embrace that development and therefore our children's behavior will not be smooth and linear. The process of developing and becoming an adult, not smooth and linear, even under the best of circumstances. You add additional adversity to that, right? And it's going to amplify. What do I mean by that? Before every burst that your child develops, a new skill, a new stage, they are likely to show a period of disorganization, what we refer to as a touch point, when things feel like they are falling apart: sleep, feeding, toileting, discipline, mood, right? You name it. But those backslides are not only temporary, they're actually signs of progress. And just as we think of every child, right, needing at least one consistent caregiver or loved one in their life in order to develop, and I'm not just talking about survival, right, keeping the child alive. Children in early development need reciprocal interactions, or
Mm.
serve and return, with caregiving adults in order for their brains to develop. But so too, parents need at least one other person in their life to support, emotionally support, and champion their parenting. And that doesn't mean advice and guidance, right? It means an emotional relationship so that the parent doesn't feel like they're doing it alone. We're not designed to develop alone. We're not designed to parent alone. So development, not smooth and linear. Relationships, not smooth and linear. And, Winnicott talked about this decades ago. You used the term good enough before, Melody, right? As parents, we don't feel good enough. Well, sometimes that gets interpreted as, oh, we should cut ourselves a break. We should be kind and compassionate towards ourselves as parents. Yes, that is true. But the concept of good enough parenting actually means good enough is better than perfect. Perfect, first of all, is not possible, nor is it preferable. Children need to experience mismatches, mistakes, errors in the trial and error process of parenting in order to develop resilience and in order to figure out how you come back into relationship and repair. All of those things are incredibly important ingredients for mental health throughout the rest of their lives.
Jane, so can I just jump in here because I want to loop Richard back in, and I think something you said is so important. We talk about what children need, what our kids need, right? But what about parents? What do parents need? So, Richard, what do you think parents most need to hear when they think that one mistake is going to damage their child?
So I had a colleague for many years named Jerome Kagan who used to say, it's not the individual notes, it's the melody, meaning that you're going to make, I mean, to Jane's point, you're going to make mistakes. You're going to be a living, breathing, imperfect human being. And to Jane's point, that's not a bad thing. That's a wonderful thing. And it creates all the, opportunities for repair. It creates opportunities also to model for kids how you talk about your flaws, which is a very important thing to be able to do. Um, So I think the one thing is that it's the melody. It's the kind of atmosphere you create in the home. It's not you'll make mistakes. It's not the individual notes.
Love that. I want to talk about how a parent's mental health can affect our children. So, Archana, can I bring you back into the conversation here? How can our mental health as moms and dads and caregivers shape a child's development, first of all? And how do we talk about that connection without blaming or frightening parents?
Great question. So I think the first thing to say is that parental distress, worry, or even a mental health condition is certainly something that needs support and attention. We know that it is a risk factor. It is associated with developmental difficulties in mood regulation and behavioral challenges. But ultimately, it is risk. It is not deterministic. It is certainly not destiny. We also know from a lot of research that these associations, though real, are, modest to small and probabilistic. So especially when we look at maternal, like depression, anxiety, some of the more prevalent conditions, it does not mean, right, that the child will go on to definitively have behavioral or emotional regulation difficulties. And part of the reason is because all of these associations are strongly affected by some of the contextual factors that we were talking about earlier, right? So is there another loving partner, co-parent, or co-caregiver? What kind of leave policies or access to healthcare does a parent have? So I think the first thing to say is that this is not deterministic. There is a lot of hope, and there are a number of protective factors. We know that many of the mechanisms or pathways through which we see associations between parental mental health and children's behavioral health are also modifiable or changeable. So, for example, we've talked about the importance of nurturing consistent caregiving. So getting support that promotes that kind of consistent, nurturing, warm family environment, both for the parent who might have the mental health condition, but also for the family as a whole. Supporting parents in their communication to explain to children what they're already experiencing, not being sort of avoidant of the conversations around health.
Can I jump in there?
Yeah.
Yeah, Archana, I'm really glad you said that because I wanted to actually ask Richard very briefly, and then Archana, I'm going to come back to you. Can you talk about, Archana mentioned having that communication, that open communication, not avoiding it or pretending it doesn't happen? Because in our house, it's really difficult. I suffer from anxiety, and I know my son notices it. And how do you have that parent-child communication that's age appropriate about things like depression or anxiety?
Yeah, so I think this is super important. And Bill Beardsley has done some wonderful research about this. I mean, essentially what the research shows is that when parents are depressed, let's take depression first. When you're depressed, you can be withdrawn, you can be moody, you can be impulsive, you can be irritable, and kids often blame themselves. They don't know that their parent is depressed. They think their parent is withdrawing because they've done something wrong, or their parent is irritable because their parent is ticked off at them. And when parents are able to talk about the experience of depression, and your point about age appropriateness is certainly right, but if they're able to say, this isn't about you, this is about something that I am experiencing right now. I am unhappy or upset or miserable because something happened. I'm working to manage it. It's also important to tell kids that you're not out of control, that you're in control. I'm talking to someone. If it's really bad, to be able to say to kids, there's other adults who can provide you support now, either your spouse or an uncle, an aunt, somebody in the community. I mean, all those things become important. And the age appropriateness is important too. But even at pretty young ages, you can tell kids, I'm experiencing something that's upsetting and it's not about you. And the data show it's just really healthy and a huge relief for kids to be able to hear
So,
that.
so Archana, with that in mind, Richard, thank you. Archana, with that in mind, how should a parent explain depression or anxiety or treatment to a young child versus an adolescent? Can you talk to that?
Um, so you're right to bring up this point about the needs in terms of communication and understanding vary a lot based on age. Overall, we know that honest communication that is direct describes what is happening. The impact in the family or the immediate sort of environment is key. Younger children need more concrete sort of information about things like, difficulty maybe getting out of bed or how a parent might be feeling, because it's harder for a younger child to understand a parent's emotional states if they're not described in more concrete terms. Older children, on the other hand, adolescents often have heard about it. They have access to a lot of information online. It is critical to not only describe a parent's own sense of, mood and experience, but also to potentially ask what they might have read online or heard online, any questions they might have for them. So I think the conversations are slightly more bidirectional, also asking about other sources of information. And throughout it all, noting that, um, me as your parent, I'm the best source of information for you about my health. I can tell you more about the help I'm seeking. If you're confused or have questions, come to me. Reading online may or may not reflect my experience and our experience as a family.
So I want to share something related to my own
Yeah,
experience
yeah.
because I suffered from a very severe postpartum depression, and which is, well in the past. But what I've learned, and Jane brought this up with repair, is the parenting journey and the opportunity to repair is never over. And I've had conversations with my son as a teenager and emerging adult about things in the past related to my parenting stress and really honest conversations where he said to me, it was really hard when I was young. I was also a single parent. You were really stressed, mom. And I just said, I'm sorry. I'm sorry I showed up like this. And it was such a healing moment. So that's also to say it's great if you can repair in the short term, but life will also present you with these opportunities in the long term. And
Amen.
so, yeah, thanks.
Yeah, Kirsten, thank you, first of all, for being so open and transparent for all of us. And also that's a real blessing to hear that those conversations may, can, and should happen into our child's adulthood as well.
Melanie, can I add one thing?
Absolutely, yes.
Yeah, no, I was just going to say, I appreciate what both of you have just said. I like you, Mel. I'm anxious. I'm an anxious person. I have to talk to my kids about anxiety. When the kids get older, I feel like I can have wonderful conversations with them about anxiety. About, it's in our family. There's a biological
Mhm.
component. Here are the strategies I've used to cope with it. Some have been successful. Some have been not so successful. Kids really want to understand, I think, how you've coped with something. And, depression, anxiety can have damaging effects on kids, but it's also true that parents who are depressed and anxious often have a lot of wisdom about suffering and have wisdom to share. And I would encourage parents to think about what wisdom they have to share about
Mhm.
depression and anxiety.
Mm.
That's really important for us to understand as well. Jane, I want to loop you into the conversation here for a moment because you used the term relational health. Earlier when you were speaking, can you tell our audience what that means in practice? And you talked about relationships. How do these strong, responsive relationships help keep everyday parenting stress, the ins, the outs, the making lunch, the getting out the door, the getting them to put on their bathing suit or getting them into bed on time? How does that keep stress from developing into more serious mental health challenges?
Yeah. So, infant and early childhood mental health, early relational health, these are terms that people might hear, right? When we say early relational health, we're referring to um, health in the earliest relationships in a child's life, and that is the foundation of their mental health over time. All of those terms really focus on emotional well-being and strength of connection back and forth between a young child and their loved ones, their caregiving adults in their lives, right? the experience goes back and forth. It's not just the child's experience, it's also the parent's experience. What we mean by that is that the health, the well-being of babies, of young children is rooted in experiences in really early relationships, as you say, that are nurturing, responsive, and supportive, not with perfection. I want to keep coming back to that
Yeah.
point, because it's dangerous, right? To hear like, oh, you have to be responsive, you have to be supportive, you have to be, nurturing. But not continuously and not with perfection. All of those relationships, of course, are also nested within the cultures and communities, the histories of families in which the child is being raised. And there's tremendous strengths that also come from that, right? Cultural values, child-rearing practices, um, ways of thinking about the world. Strong connected relationships don't just benefit the child's developmental process. They benefit the adults also, right? One of the things I said before is that adults, the caregivers, benefit from having the support that they need to be well themselves. And sometimes that does mean extra supports so that as parents, we have the emotional resilience, the emotional energy to show up in a nurturing way with babies and young children. What that turns into in terms of early relational health is a really young child developing basic trust in their attachment, right? Their ability to feel like their own emotions are trusted and trustworthy. They have meaning. They're being responded to. People are trustworthy. That forms the ability for them to build even more relationships and to also repair the disconnects that are going to happen in a relationship, especially during periods of increased stress, like the touch points that I mentioned earlier. When when that basic trust is there, children will know who to turn to co-regulate them, meaning under uncomfortable, you're going to hear me never say negative emotions, uncomfortable emotions, right? They will turn to their trusted adults for the co-regulation. And in that trusted relationship, parents are co-regulating, helping the child cope with their uncomfortable emotions. Over time, that will become the child's ability to regulate themselves, to control themselves, right? Sort of like the difference between thinking of discipline as punishment, like, oh, we've got to eliminate this behavior, versus discipline as teaching, right? The child is developing their own self-control. Well, within obviously, children are not finished with that in the earliest stages of development, sometimes not well into their adulthood. um, but all told, that basic trust and that ability to self-regulate really forms the foundation of the child's self-esteem,
Can you give us,
self-confidence. Yeah,
I'm so sorry to interrupt. Can you just give us an example? Because I love what you were saying about, self-regulation. As far as parents go, I myself, all the time, I will lose my patience and then I snap. And then I feel terribly because I've done exactly what I'm trying to teach him not to do. Can you walk me through a simple repair after a parent maybe loses patience with their child?
sure. So that's a great example of repair, right? The opportunity after there's been a disconnect, after there's been a mismatch, there is the opportunity to come back into relationship, right? And model the key things that were helping children to develop as emotionally competent people, the ability to understand the emotion that was being experienced, label it, name it, tame it, right? Be able to express the emotion, be able to understand that the emotion was tied to a circumstance and then it led to an impulse and behavior, right? So if after losing it, Melody, right, you said snap, coming back in, you know what? I was feeling really angry. I was feeling really frustrated, right? I love you. I don't want to be hit. Let's just say that's the example, right? When you hit me, it made me feel really frustrated and angry. And I yelled. And then I left the room. And I went into the other room and I took some deep breaths and I came back in. I love you, and I I want everybody in this family to feel safe. And hitting is not something that we do, for example. The repair is where the teaching really can unfold, right? We're not holding ourselves up as paragons, but we are saying that we too are going to lose our temper sometimes, right? When we say children, young children test our limits, it's not just that they're testing, oh, does mommy say the same thing as daddy? Does grandma let me get away with this? Do they say no the same thing every time? It's not just that they're natural scientists. They are. They're testing the limits of our patience. Where do I hit that limit of the other person's self-regulation? And that's a crucial thing for them to understand in order to develop empathy. Like, oh, right, my behavior does have an effect on other people. I need to learn how to manage my own impulses that come from my own upset. So that repair melody, right, feeds into the child's ability over time to be able to say, I'm angry, I'm frustrated, instead of hitting or throwing the toy or
Right.
breaking the, whatever. Yeah.
Yeah, I want to talk about where families can turn for help because I feel like I'm in this incredibly blessed position where I've got this panel of the, world's most brilliant minds when it comes to parenting. But the reality is, so many parents out there are just struggling every day and they don't know where to turn to. They don't know where to begin or if they can even access specialty mental health care. So, Archana, I want to go to you here. What are the most promising ways to meet families earlier and more effectively and get help like this?
Yeah, this links back to what we were talking about earlier in terms of how do we provide access to resources and support for so many parents who are struggling, right? Easier access to a lot of people. And part of it was also mentioned earlier is that it can't be something that is hard to reach and takes up a lot of time. Most of us don't have that. But hopefully, many of us have at least one trusted, healthcare provider. Um, it's not always true, and I think that is also a concern. But I do want to say within healthcare systems that integrated models of healthcare where mental health care services are integrated, for instance, within primary care, but also specialty care, offers a unique opportunity to provide early scalable access to care. And what this means is when I go see my primary care doctor, and it could be for an annual well visit or it could be for a cold, but we often have a relationship with them. We can talk to our physician about how we're feeling. Often hospitals now do universal screening. But even if without universal screening, often we know our physicians for a while. That makes it easier to talk to them. It's a not a stigmatizing environment of a specialized mental health service. Um, I think just even bringing up that I've been struggling at home. I've been snapping a lot. It's been hard to get out of bed. I think even just starting the conversation can sometimes lead to more detailed evaluations, activate screening, and hopefully other resources. Overall, I guess I'll just add that we need sort of a stepped care approach where there might be universal education and screening, but then depending on what the concerns are, increasingly, specialized levels of care.
May I comment to that really quickly, Melody?
Sure.
Um, so here in Massachusetts, we lobbied long and hard for pediatric care to be able to provide parent screening for mental health issues, postpartum, specifically postpartum mood disorders. It was a long battle because the system was set up to treat pediatric care as specifically and only for the child, right? And the lobbying that we engaged in was very much in service of this idea of early relational health, which is that the child, of course, does not exist in isolation, that the point, the target of treatment or the target of care is the relationship. And so the argument became, this is health care for the child if pediatric care can screen for parental mental health issues. And that's been a huge sea change here in Massachusetts that also is spreading across the country.
So, Jane, thank you. And Kirsten, I want to bring you in now because that then begs the question. Obviously, we know Parents need help and want to receive help, many of them. But how can health systems support that caregiver without making our kids' appointments all about us, without making the appointment feel like an assessment of my parenting when I go in, though I need help?
Yeah, that's a very challenging question. So I'm in a school of public health, so I really believe we need to look beyond the traditional medical healthcare system, and I'm 100% supportive of that. People who have moderate to severe depression need access to psychiatric services, so I'm not at all putting down the traditional mental health system. But when you're talking about 50% of parents saying their level of stress is interfering with functioning, that it's not going to work to say each of them needs a therapist, an individual treatment. And there are many, many things that work for anxiety and depression beyond the traditional one-on-one either therapy or psychiatric model. For example, there is good evidence that exercise both prevents and can help improve depression. I could give a whole list of those things, and those are also hard to engage in. And I can hear it myself as a mom when I had a young kid, like, now you're telling me to exercise more. Like, when am I going to do that? Social connection and uh, uh, activities in schools, mental health services in schools. And I honestly wish I had all the answers. I actually don't have all the answers. But what I do know is that we have to look beyond the traditional medical system and look at the other systems in children's lives, schools, activities, clubs, scouts, and ways that those can provide both connections for kids and connections for parents. And I'm not saying those are going to treat severe depression, they're not, but they could provide a lot of support for parents who need this, like Jane said, relational support, connection with other parents. I know in the work that Archana has done, she's talked about her groups. She can correct me if I'm wrong, but one of the biggest benefits of the groups has been the support that other parents have found in each other, not necessarily all the skills. I mean, the skills are helpful, but it's not all the skills they're learning. It's actually hearing other parents who are suffering or struggling. And I wonder for ourselves as parents, are there ways we can be more honest and authentic with what we're struggling with our friends and hear from them rather than pretending, which I think I did so much, especially when my kid was younger, like everything is great. My kid's great. Your kids, which just really got in the way of any sort of authentic connection. So I feel like I know I haven't really answered your question, but I just want to think of this. We need to think of this in a bigger way, and I wish I had the answers. Hopefully someone does out there.
Melody, can I add to this? Or
Absolutely.
no, I just think this point is crucial. And every branch of government can help with this.
Right.
I mean,
Yes,
when we
exactly.
think about housing, when we think about
Yes,
transportation,
exactly.
when we think
Food.
about food, when we think about parks and recreation and
Yes.
places for parents to informally gather in a community. There used to be a family support movement in this country 30 years ago that was providing families with young children places to gather and connect with other parents and
Hmm.
talk about parenting issues. Um, the loss of, the decline in religious participation, I think, is a big deal too in many families, and the decline in community and community organizations. And we really need to recreate a social infrastructure in communities for families too, particularly for parents of young children. So there's a lot of things to do at every level of government. Yeah.
Richard, I'm
So
glad you brought that up because that was actually leading into my next question for Karistan, because
Oh.
public policy, this is obviously your world. So what would it look like to treat parental mental health as a shared public responsibility? Where do we begin even?
I was going to say, you just said it, is that I think of every policy as a mental health policy. So whether it's paid parental leave, whether it's housing policy, providing secure housing, income support policy, there's evidence in countries where income support was provided during shutdowns that in those countries, levels of mental health problems and distress went down. There's all kinds of, and Richard can probably talk more because he's even more in the policy than I am, but there's so many things we can do that would help with mental health, and anything that provides social support stability, reduces uncertainty, that will actually benefit mental health by reducing stress. But I'm sure Richard has other
No, no,
views.
you said it beautifully. I mean,
Yeah.
I think it is all of those things. Really, if you think of just about any branch of government, it is influencing parents in one way or another. And there are things that they can do that are harmful to parents, and there are things that they can do that really benefit parents, particularly around creating communities where people flourish, where people are
Mm.
connected.
So, it's interesting because, of course, all of this commentary about the macro level and systems level is crucially important, right? But on the micro level, what are the day-to-day habits that families can engage in
Mhm.
to also practice stress management, right? Micro practices. I cannot tell you how many parents over the last however many decades I have said to this to. Do you ever need to go to the bathroom? And parents always say, of course. Like, do your children know that you go to the bathroom? Yes. Can you give yourself permission to pick yourself up out of the fray? Go to the bathroom. Go to the bathroom. Can you give yourself permission to take care of yourself? Do a body scan, even if it's for 30 seconds, a body scan. Where am I feeling the tension? Is it my head? Is it my stomach? Is it my chest? Are my shoulders up at my ears? And take 30 seconds to take care of yourself. Breathe. An imagery exercise. A progressive muscle relaxation, just little micro practices to punctuate the day. Often with that message of being nurturing and responsive, we forget to take care of ourselves, right? And there's so many little micro practices, but that require parents giving themselves permission. I deserve to take care of myself. I don't deserve to be screamed at. I don't deserve to be hit, right? Whatever it is, I don't deserve to have blocks hitting my head, whatever it is that's happening. Do you need to go to the bathroom? Well, yep, your child doesn't need to know that you don't actually have to go use the toilet. Go in the bathroom, close the door. Well, they'll still be screaming. They'll pound on the door. Uh-huh. Give yourself the opportunity to disconnect,
That's
take care of
really
yourself, come back in
Great.
and repair. I'm sorry if I scared you when I yelled. I went and I took care of myself and now I'm back. Let me give you a hug.
these micro practices. That is perfectly explained. Thank you. Because I was going to ask, what are micro practices? Okay, now I get it. Just taking, even if it is 30 seconds, just taking time to take care of yourself. Okay, before we wrap up, I want to close with one sentence from each of you because we're running out of time.
Mm.
You've all been so amazingly helpful in this wealth of information. So, what is the one single most important thing you want a parent or a caregiver to take away from this conversation? The one thing, and why don't we, Jane, we'll start with you since you're already up on the screen.
Sure. Mistakes are to be expected. They are a natural, healthy part of just enough stress to help your child develop coping and resilience. Stress is going to peak during periods of developmental disorganization, touch points that occur before the skill. You can see when they're coming, and they give you an opportunity to embrace a strengths-based view of your child, that they're not doing these things on purpose, that they're in process of developing self-control. Our job is not to control them. It is to maintain our self-control so that they can go through their period of disorganization and come out of it with another step towards autonomy and independence.
So, by touch point, you mean friction, moments of difficulty within your child.
The periods of disorganization that development requires in order to develop the new skill.
Okay. Got it. All right, let's go to Karistan next.
Wow, last sentence.
We'll give you two if you want.
Give me two. Like, I was thinking, what one thing I wish I had known earlier in my journey, and I'll say two things. One is I wish I had focused on really accepting and loving my child for who they are rather than focusing on what I'm making them to be or like my goals for them. And then the other piece for myself is I wish I had understood that repair is always possible, and that you always have the opportunity to revisit things you've done wrong in the past and talk about them and learn from them and move forward. And that is a gift that you'll get later, even if you don't do it at the time.
That's really beautiful. I will absolutely, I just wrote that down in my notes. I absolutely try to live by those words, accepting your child for who they are and not who you maybe want them to be. That's beautiful. Arshana?
Hard to follow those acts, but I guess I'll say that, I think as parents, we are often more willing to do for our children than we are willing to do for ourselves, right? Like giving ourselves permission had come up earlier. And I think like recognizing that is like, caring for our children is a strong motivator, but ultimately investing in ourselves, whether it's in those micro practices, whether it's seeking out, help to at least talk through and start initial conversations when we need help, is as much an investment in ourselves. It is as much an investment in our children and our family. So really investing in parents, I would say, is a family-centered and two-generational approach.
Love that. And Richard, last but not least, we'll come to you, my friend.
Thank you, Melody. I'm going to cheat and try and squeeze in three things, so I will be very quick.
Okay.
One of them is that rather than telling your kids the only thing I want is for you to be happy, I hope more parents say the only thing I want for you is to be kind, or I want you to be kind and I want you to be happy. And I say that because we will live in a better world if if parents are prioritizing kindness and caring for other people, including people who are different from them, but also because I think it's so key to relationships and to well-being. The second thing that I was going to say is that I do think, and we've talked about this, that it's important for parents to be able to talk about their emotional states with their kids, just to be able to say in age-appropriate ways that I'm anxious. And the third thing is just that it's important to maintain social connections when you have kids. I mean, a lot of parents are coming to their lives become their kids, and they're emotionally relying on their kids in ways that I think are hard for them and hard for their kids. And so keeping a friendship can be really vital.
Well, I did not expect to be brought to tears by this conversation, but Richard, you've done it. Teaching your child to be kind above all else. Right. That's really beautiful. Thank you all so much for this conversation. I truly do not have the words to tell you how incredibly blessed I feel to even have had the chance to listen to you all, and the advice and the guidance and the wisdom is just incredible.
Thank you for bringing us together.